Okay, I think we are all ready to go now. So, hello everybody, my name's Hayley Clark. I'm chair of the communications group for the Society of Sports Therapists, and a big welcome to you. This is the return of the SST webinar series, and it's the first session for 2022. And tonight's webinar is all about the role of psychology within injury and rehabilitation. So I'll just kind of quickly go through the format just to remind everybody, for those who are new, we'll remind you of the format of the webinar tonight. So it's being recorded and it will be available to you afterwards. And you can access your attendance of certificate shortly after the webinar as well, because you will receive an email if you've registered for tonight. You will receive an email and then that will guide you on how to access your certificate. So tonight I'm joined by two fantastic guest speakers, and they're going to talk to you for around 50 minutes, and then we'll have a good 20 minutes at the end for a good long Q&A session where you can pose your questions, and our speakers will do their very best to help you out with those and give you some answers and some tips. So the chat function is available for you to use throughout. We are monitoring that, so please do feel free to pop your questions on there and we will monitor those and we'll come to them at the Q&A. We'll try and do as many questions as we can in the time. Obviously, we don't have lots and lots of time, but we will try and answer as many as we can, and those we can't, unfortunately, we won't be able to answer those tonight. So I'll move on now and I'll introduce our two guest speakers. So I'm really pleased to welcome Dr. Dale Forsdyke and Dr. Adam Mandel, who are really excellent speakers. Dale has a keen interest in the psychosocial factors and return to sport outcomes. He is a sports injury educator, researcher and practitioner, and he is a member of our Society of Sports Therapists. He's currently programme lead at York St John University. And he's had many experiences in actual working in place. So he's been head of science and medicine, and he's worked in various performance roles, including the FA talent pathway. So welcome, Dale. And we have Adam. Adam is the course director, Sport and Exercise Health Science at Leeds Beckett University. So welcome to you, Adam. He's also the chair of the BASES Division of Psychology, so he has a lot of experience and guidance to share with us today. So that's it from me for now. As I said, if you have any questions, pop them in the chat, and I will hand over now to Dale and Adam, who will start their presentation for tonight. Thanks, guys.
Hello everyone, I'm just going to try and share my screen the best I can. Can everybody see that absolutely fine? Okay, great. So welcome everybody. I think first I'd like to just thank the Society of Sports Therapists for the opportunity for myself and Adam to talk about the psychology of sports injuries. And thank you to all the people in the audience for giving up their Wednesday afternoons, Wednesday evenings, probably after a busy day at university or at work to listen to us. The title of our talk today is The Role of Psychology Within Injury and Rehabilitation. On the front, we've got our Twitter handles. That isn't to kind of proliferate our followers at all. But if you want to engage in any sort of discussion about what we've put on or what we talk about at the end of this, you're very welcome to use that. Now, in terms of the aims of our talk, we've decided that we're going to have two. One's very much about raising awareness, improving knowledge, understanding, and the other one, and more importantly, is about trying to enhance practice so that hopefully many people in the audience today can go away with some little hints and tips that they can embed into their own practice to improve their outcomes for their athletes and patients. So the aims of the talk today are to outline a rationale of why psychological factors are important to rehabilitation and return to sport outcomes following sports injury. And the second aim of the talk is to explain practitioner-focused strategies aimed at being more psychologically informed to enhance rehabilitation and recovery outcomes from sports injury. So before I move on, I thought it'd be really good to scope what do we mean by psychological factors, and highlight a few important points that when we start about talking about psychological factors. So for us, psychological factors involve the emotions, the cognitions and behaviors of that injured athlete or patient. Emotions are how we feel, cognitions are how we think, behaviors are how we act. Okay, and they're really important, guys, for us to really start thinking about, well, what does that look like across the rehabilitation of that person, all the way into them actually being re-engaged back into training and back into sport. Now, the key problem with this really is that we are working with complex individuals that exist in complex social spaces. So if we take the emotions, the cognitions and behaviors, they're really influenced by many socio-demographic and socio-contextual factors, such as we've got life stress, the type of injury and the injury characteristics. We've got the finance and the financial implications of that individual. We've got the age of the patient or the athlete. We've got their social network that's around them, and the quality of that social network, not just the size of it. And obviously we've got their sex as well. So there are many, many different factors that actually make this athlete really complex. And these emotions, these cognitions, these behaviors all interact with these socio-demographic and socio-contextual factors. Now, importantly for us, it means that the cookie cutter mentality that often we may see in some healthcare practice isn't optimum, okay? It means that we can't be treating these complex individuals existing in complex social spaces as all being the same. We are, you know, there's lots of things which will drive our behaviors, which will influence our cognitions, influence the emotions, lots of the environmental things. So we can't just be basing our treatment and expecting all athletes to react and respond in exactly the same way. That cookie cutter mentality probably is not doing the best by your patient or the athlete at all.
And when we start thinking about some of the different stages and how sports psychology fits in across each of these, really, for a few years now, we've been talking about these 5 R's around the different stages of injury. And one of the important things to consider here is how they impact on each other. And these 5 R's being around injury risk, responses, rehabilitation, return to sport, and then retirement. And sports psychology plays a role across each of these, both in terms of understanding how an injury might happen through to how we might reduce the risk of it in a clinically meaningful way, all the way through to the other end of the spectrum around the different factors that might influence an athlete's decision to retire, even when perhaps the injury doesn't necessitate it. Now, through each of these different stages of the injury journey or this injury lifespan, we can start to see that there's a little bit of a relationship between each of them. So if we consider how things like pre-injury factors, so the different considerations that might have led to an athlete becoming injured, those factors can actually influence the way that an athlete then responds to the injury. And if we start to look at then how they've responded to injury and the way that they are starting to think and feel and act as part of those responses, that can then start to impact on their rehabilitation their rehabilitation progress, not least of which through factors that might influence their rehabilitation adherence, and some of the things that we'll touch on a little bit later on. And that then becomes important because we know that primarily, from a behavioural perspective, an athlete's rehabilitation adherence is one of the most significant factors that will influence some of their return to sport, return to performance outcomes, both on an individual perhaps well-being perspective, as well as in some of the more functional injury and some of the more performance-related considerations. And then that feeds forwards into, again, as we mentioned, some of those factors that might determine whether or not an athlete makes that decision to continue or not. Now, as Dale mentioned, primarily today we're going to focus on those areas that are in the red circle in the middle. We're going to look at some of the different ways that an athlete might respond to their injury and some of the factors that influence that response, and how that is important for you as sports therapists, but also how that response then transfers through into rehabilitation, some of the different psychological, psychosocial factors that might influence rehabilitation, and then some of those behavioural aspects, and then move that forwards into how that might link then through to return to sport outcomes. And I think one of the important parts about this is a lot of the positioning of this work today is very much focused on, I guess, its position is almost within our philosophy to how we work with our athletes. It's a focus on what you as therapists can do and what is within your scope of practice, and how you might be able to develop maybe some more different, what we refer to as psychologically informed strategies that do fit within your scope of practice, as opposed to getting hung up and maybe being concerned about some of the things that might create some uncertainty, and things where you might be more concerned about things that you can't do. Okay, so focus of today through injury rehabilitation, and then how we work through that in terms of enhancing return to sport and return to performance outcomes.
Okay, so on this slide, I just really wanted to make the point of there may be many people in the audience going, do you know what? Psychology, or the addressing of psychological factors with injured athletes or patients, it's not my role. It's the role of a sports psychologist or a clinical psychologist. You know, it's not me. You know, I shouldn't feel like I have to do this. And unfortunately, guys, psychology impacts our practice in many, many ways, in many forms. Some of the more common things that we will do when we're working with a group of athletes, or when we're working in a clinical setting, means that we need to be savvy around psychology. So psychology should be left to psychologists and not sports therapists. Well, it shouldn't. You know, I'm a passionate believer that we're the ones that forge the real productive, collaborative working relationship with injured athletes and patients. That we're the ones that share their successes. We're the ones that share their setbacks. We're the ones that are probably there, stood at the side of the pitch with our gloves on, and just looking and feeling a little bit anxious about that player's first contact back. We're the one that invests in them. So I'm a real passionate believer that, yes, there may well be times, guys, where if we work with a sports psychologist, we may refer, we may consult, and that would be good practice around sharing perspectives. And there may be times where we may suggest that there may be some severe psychopathology, orange flags, where we should have some referral pathways to safeguarding and welfaring, or we've got a mental health first aid qualification, so we know the pathways. But let me just throw some common scenarios that really many sports therapists may have. So scenario one is, you know, I'm introducing a strength-focused injury risk reduction program within women's netball. Okay, now some of you that may think psychology actually isn't part of my role, and we're just saying, actually, I just need you to do this, without looking at why, educating and questioning around how do I get people to adhere. We see lots of problems in actually the adherence to injury risk reduction programs. And that's probably why that we need to start bringing people on that journey. Or I talk a lot about we've got to fight for our right as sports therapists to make people adhere. We've got scenario 2, which is providing reconditioning exercises to develop power in a female volleyball player. Again, it's about fighting for the right guys. That person's not likely to adhere unless we can help them or engage them and empower them around their exercises that they're going to do. Why should they do them? And that we share that journey with them. Scenario 3, making decisions over readiness to be integrated back into training in a male footballer. Again, if we start making decisions purely based on biology or purely based on function, then again, I think we're missing part of the puzzle, which may help that person return back to training confident in their performance, confident that they're not going to get re-injured. So really, as you sit back there, when you're working with every single patient, athlete, team, psychology really does underpin most of our practice. We probably aren't aware of it, but again, we've got to fight for our right, bring our athletes, bring our teams, bring our patients along with us on their journey. And we can only really do that, guys, if we get more savvy around psychology and maybe have some things that we can say, well, in my practice, this is what I do to offset concerns. This is what I do to reduce the stress of injury. So, like I said, I'm a real passionate believer that psychology isn't just the domain of psychologists, that actually we're the ones there day on day, week on week, month on month, sharing that journey. So we're the ones that probably need to be able to cater for that athlete psychologically. Now, we're going to take a bit of a step back now. And I like doing this to put what the landscape looks like. So obviously this particular presentation is all about rehabilitation and recovery landscape. And I just want us to have a sit back and look at what does this landscape look like. And what we need to think about is on this landscape is now is never a better time to be an injured athlete. It takes a little bit of getting your head around that thought, but really now we should, if you're an injured athlete, you should say, actually, I feel pretty efficacious that I'm going to have some really great return to sport outcomes or recovery outcomes. Because if you think about it, we've got better technology, we've got better diagnostic screening tools, we've got better surgical intervention, we've got all sorts of technology that can augment feedback, stimulate artificial muscle contractions. I can use GPS to make sure that when I'm returning athletes back to sport, that they've matched match demands or even exceeded those. So all of these things point to now is the best time to be an injured athlete. So let's have a look what the research says, what the landscape looks like in terms of recovery from sports injuries. So we know, unfortunately, the landscape isn't great. Sometimes I call it poor. Sometimes I refer to it as underwhelming. But we do see lots of athletes who, from injury, have chronic symptoms and chronic impacts. And by that, I mean things like long-term joint pain, long-term back pain, functional deficits after being injured. Well, hang on a minute. The technology, the interventions, is there. Why does that happen? We know that if you're an injured athlete, it affects your career. Okay, your career trajectory is directly impacted. Now, the bit of research I've highlighted there talked about injury in terms of academy football, in terms of continuation, the retain, the release, the retrial sort of decisions, the transition from youth athlete into senior athlete. But we do know that injury impacts career trajectory, okay? We also know that there's an underwhelming amount of people that actually return to their pre-injury sport. You know, around 45% of people don't return to their pre-injury sport. Now, you might go, well, 65% do. But of those 45%, you end up thinking, well, what do they do? What have they gone on to do? Have they suddenly become disengaged with sport and exercise together, which has its own public health issues? But again, 45% of athletes don't return to their pre-injury sport, when probably that is their intention right at the start of being injured. We also know that, you know, many athletes really struggle to hit the high notes that they did pre-injury after being injured. So return to pre-injury levels of performance is tough for lots of athletes. Okay, they're unable. Yes, they may return to sport, but do they retain their similar levels of performance? Do they retain their status within that team? We're dealing with a situation where actually many athletes can't, for whatever reason, return to their pre-injury levels of performance. We know that injury is the number one cause of non-volitional retirement. And again, on the face of it, you go, okay, that makes sense. However, if you're an athlete who's invested, you know, years and years, had to give up many things that the people around them don't have to give up, that you've trained, you know, you've competed, you've been committed and invested in that sport for so many years, for that to be ripped away due to a sports injury, and you are unable to then continue in that sport, is a huge, profound life experience. And let's not forget in the landscape as well, re-injury. And re-injury rates are high. They're as high as 48% with some pathologies. Now, the real sucker punch of re-injury is that they actually lead to a greater amount of time loss compared to the index injuries or the original injuries. So we've got this disparity here, haven't we? Which is, now should never be a better time to be an injured athlete. Okay, and hopefully you kind of agree with me on that. However, when we look at this rehab and recovery landscape, it isn't as good probably as we would expect it to be based on that statement. So this really was the protagonist for my research in this area, but and my scratching my head as a practitioner as well when I saw this landscape, going, well, actually, could there be factors other than and additional to physical and biological factors that are related to rehabilitation recovery outcomes? In essence, are we not looking at something? Are we over-focused on looking at something else? Is there a piece of the jigsaw that we simply have been missing in our practice for many, many years, which may enhance some of those outcomes that we can see?
Now, when we start looking at when an athlete is injured, one of the important considerations here, particularly for sports therapists, is that there are going to be lots of different indicators of kind of positive or more negative psychological factors, psychological considerations within that sports injury experience. And as practitioners that work with injured athletes, you know, because ultimately, because we're at the coalface and we're often spending lots of our time working with patients or working with athletes, we can influence the balance of these different things through the way that we adopt our practice. Now, naturally, we're aiming to try to strike the balance so that we have athletes that are experiencing more of these positive factors and fewer of these negative factors. And we have a really important role within within that process. But some of the other things that are important to consider here is that, whilst yes, when we start looking at things on an absolute level, some of these, in air quotes, negative factors, we can also start working with our athletes around, well, starting to understand why some of these more negative factors have appeared, but also how the athletes are starting to understand and interpret some of these different factors. So I'm going to start, probably a little bit counterintuitively for some, I'm going to start looking at some of these negative factors and some of the more, I guess, commonly reported negative factors. And I guess just chat through a couple of examples of around how we've been able to work with some athletes and some of the I guess, more recent qualitative research evidence around some of these areas that started to understand the athlete's perceptions of these and how they might influence the athlete's injury experience a little bit. So if we take things like re-injury anxiety or fear of movement or fear of re-injury, those sorts of things, typically speaking, quite rightly so, they've historically been considered just purely negative factors. However, if we start to look at some of those things and strip them back a little bit, well, what happens when we start to get worried about different things and we start to get worried about being injured? Well, we can start to pay attention to some of the things that might mean that we would get injured again. We can start to pay attention, though, by definition after that, to some of the different things that might stop us from getting injured again. So when we've started talking to athletes a little bit about, well, actually, when you're thinking about being worried about your injury, to you as an injured athlete, how are you interpreting that? What are you thinking about that? And asking those questions quite openly, we've started to see, evidence from different cases and different athletes around, well, actually, it's helping me to concentrate a little bit more and a little bit more purposefully on what it is that I need to do to prevent myself getting injured again, or to reduce the risk of me getting injured again. It's helping me to focus on understanding some of the different elements of my body, my performance, different reasons that I might have been injured, all those sorts of things. So I'm not for 1 second saying that things like re-injury anxiety, fear of movement, those sorts of things aren't negative considerations. Absolutely they are. But there are certain things that we can do in the way that we have conversations with our athletes around these different things that might help the athlete to reinterpret certain aspects of those in different ways that can actually lend themselves to start producing potentially some more of those more positive factors and starting to help them to understand how we can progress through that injury experience a little bit more positively. So just again, if we carry on down the route that we've just started on, this idea of athletes being worried about getting injured again, or being scared about getting injured again, or being worried about performing certain types of movement. Well, actually, if an athlete starts to understand the different reasons behind that, starts to understand the different ways in which they can reduce the risk of getting injured again, they start to understand the different factors that can impact on that. And we have a real important role in helping them to construct their understanding of it rather than us just telling them stuff. That's a huge contributor to them experiencing some form of growth through their injury. They're starting to understand themselves more. They're starting to understand the way that they think a little bit more. They're starting to understand their body more, the demands of their sport more, those sorts of things. So from that perspective, there's one example there of how some of the different types of conversations that we can have might start to influence the balance of some of these different things. And actually, we can start to then see how, I won't necessarily say a domino effect, but some of these more positive factors can then start to influence each other potentially in such a way that helps to prepare our athletes for, that helps to prepare our athletes more for successful progression through their rehabilitation. It helps to prepare them for those inevitable times where we will experience plateaus, we will experience setbacks, we will experience those bumps in the road that none of us like, that we don't want to there, but we all know that they're a part of that injury process. And athletes can then start to look at things from a little bit more of a more optimistic perspective. Actually, I understand this a little bit more. I've had a little bit more of an input into this. I'm more in control of this now. Because I'm more in control of this now, I'm starting to feel a little bit better about it. Those sorts of things start to become really important in developing some of those optimistic aspects. And sometimes some of the work probably, that some more of the, I guess, is moving more into the sports psychologist side of this, around allowing the athletes and giving athletes the opportunity to just really, emotionally disclose a lot of the elements around their injury, so that we can help to renew and develop some of those more optimistic positions on their injury. And then again, some of those elements around working with our athletes to get that balance between challenge and support during our rehabilitation activities with them, working with them in such a way where they're invited to kind of select and then reflect on their progress through the rehabilitation activities, working with them in such a way where they get to reflect on setbacks and why those setbacks might have happened, and understanding those and trying to come up with ways collaboratively with their sports therapist, we can start to develop more resilient athletes in that respect, and helping people to develop more self-awareness around themselves and around their injury and those sorts of things. So all of these different factors, the things that you would probably say to some of the points that Dale made earlier on, is this the role of a sports psychologist? Well, or a sports psychology practitioner? Well, actually, you'd probably go the other way and say the majority of things that I've just been talking about are probably the bread and butter work of a sports therapist, in terms of the work that, I won't necessarily say work that you could be doing, I'd probably say work that you should be doing in some respects, around helping the athlete to develop in those ways. And you know, we can start to move forwards then further down that list of, you know, further down that list of bullet points there around to this nice term of psychologically ready. Well, what does that term psychologically ready mean? Everyone uses it all the time, and we can go to lots of different perspectives on that. If we go to some of the measures around it, psychological readiness is essentially confidence. If we go to some more of the, I guess, more evidence-based, more empirical perspectives on it, it's a combination of confidence in both in terms of sport performance and in the ability to remain injury-free. It's lower levels of being worried about getting injured again. I'm viewing some of those aspects a little bit more positively. And it's lower levels of being scared of getting injured again. So there's those different aspects that again, as sports therapists, we've got a really important role in. How can you expose your athletes and appropriate developmental way so that they can progress through their rehabilitation activities at a manageable rate? How can you revise and progress the different goals that you're working with your athlete to set once they've been achieved? How are you highlighting and really celebrating those successes so that the athlete actually consciously starts to recognize that they're achieving things? All those things become really important parts of shifting this balance to the more positive factors, whilst also recognizing the fact that some of these negative factors, they will happen. They're almost a typical part of an injury experience for people. And again, if we look at some of the more recent evidence from the past 2 or 3 years around people who tend to have more successful rehabilitation outcomes, actually, for those athletes, recognizing that some of these more negative factors happen, that they will change at different levels, they will change in different ways and in response to different aspects, and the athlete actually doesn't get too hung up on that and is supported to recognize that that is part of the injury experience. Those sorts of things become really important in facilitating those more successful rehabilitation outcomes. So hopefully, through our almost standard practice in terms of how we work with our athletes as injury practitioners, we can increase the number, the experience, the quality of these positive factors, whilst also decreasing the number or the volume or the intensity of these negative factors, but also, wherever possible, altering the perceptions of some of these negative factors so that we can then reduce the impact that they can have. And there's lots of different things that we can do as injury practitioners to support this. It's really common that athletes will feel isolated as part of their injury. Okay, well, if we're working in team sports, as in interactive team sports, great. Let's work with our athletes where they're doing in their injury rehabilitation activities within the vicinity of their interactive teammates, so they can see what's going on with the team. The team still feel that the injured athlete's part of the team. In coactive team sports, where it's maybe individual athletes in individual disciplines working, great, same thing. How can we have them doing their injury rehab on the track near their teammates, so they've still got the opportunity for those social, social interactions? How can we work in such a way with athletes where we can start to think about, this aspect of loss of identity, little things around having their athletes turning up in the kit, in training days, on match days, still feeling part of the team, inputs into team decisions, team tactics. All those sorts of things are really important. And offsetting that loss of athletic identity, again, if we look at the evidence, is one of the things that is so important around helping athletes to really feel like they are still an athlete as opposed to just an injured person. Now, in terms of one of the challenges that we face with this, actually more so than biological or physical factors, psychological factors are changeable and they probably are easier to mask. In terms of some of those psychological and those biological or physical factors, we can probably all relate to the athlete who maybe doesn't try quite as hard in a fitness test or a functional activity or something like that you're working with them to do, as to see whether they're ready to return or not, if they fancy missing a game and want to play in the next one afterwards instead. Now, the psychological factors are probably a little bit easier to mask, but one of the bigger challenges is that they are dynamic. On any given day, somebody can be having a nice big smile on their face and be laughing and quite jovial, but leave the training setting or leave the match setting and they feel quite isolated, they're upset, they're confused, all those sorts of things. So that the injury presents a challenge in that respect, not only for the athlete, but also for us. And as Dale alluded to earlier on, particularly around some of those socio-contextual factors, we're working with complex individuals when we're talking about athletes of varying levels. You know, if we take that up to and including the very highest levels of sport, there's all sorts of different considerations that fit within that. And because those athletes are living in complex social spaces, there's lots of different factors from within those social spaces that can impact on how they might react to that injury. And if we start to then throw in the other kind of chestnut and almost elephant in the room, that actually when it comes to some of the higher levels, one of the main challenges that we face is that when an athlete is injured, their emotional integrity can be quite poor. So, you know, they might say the different things that they think we want to hear as a response to different things. They might start talking about their injury in socially acceptable ways. They might be more susceptible to different parts of feedback. They might be even at a point where actually, from a rational thinking point of view, one of the challenges with rehabilitation adherence, they might not even be able to think about rehabilitation adherence yet, because they're still just trying to process the impact of the injury and how that's impacted on their life, let alone their sport. And that can be a case particularly in terms of severe injuries or recurrent injuries, or where there's been, you know, again, the kicker in that situation where we've got severe injuries, but then that becomes a recurrent one as well. So lots of different challenges for us there as sports injury practitioners, but particularly for you folks as sports therapists. You know, you are the people who will be there literally throughout the whole injury journey. Most likely, you're the first person that they see when they go down on the court, on the pitch, on the track. You're the last person that they see before they're signed off to return to sport. So a lot of the things that we speak about in these types of sessions around developing really strong relationships and being able to start to know what's a norm or what's a typical behavior, or, you know, for your athletes, and being able to detect some of those differences in those becomes really central to the work that you're doing.
Okay, so let's have a look at how good we are in terms of our practice around psychological factors. Let's just have a look at where we are. So currently, research would say that we have this situation on our hands, which is there's an over focus maybe on the biological and the physical factors, and there is an under focus maybe on psychological factors. Okay, now you've got to think about, well, why is that? Where's the evidence, and is there some salient points that we need to highlight here? And for me, one really important point is that rarely in practice, psychological factors are considered when making really important clinical decisions, whether that's progressing from a rehabilitation into a reconditioning stage, whether that's progressing from reconditioning into some more pitch-based, sport-specific work. Rarely are they. And we know there's some good evidence out there which says this is the case. In 2019, Berge did a lovely systematic review on return to sport criteria and from ACL injuries. And out of 209 studies, there was only one of those 209 studies that used a measure of psychological readiness. So it does appear that we are over-focused on the physical and biological elements. Now, why is that? well, we know from the work of Chesterton, and Caroline Heaney's taken a real lead on this, which is practitioners often feel underskilled and over-challenged about psychological factors. You know, it's maybe underrepresented in their training. Their training hasn't adequately given them the competence and the confidence to be able to work with their athletes using a more psychologically informed approach, which probably means practitioners then step back and sit on the things that they're comfortable with and making decisions from a lens that maybe they feel more efficacious about. But we know this is the situation. This is where we are at the moment. And maybe that doesn't mimic best practice. And if we do look at best practice, and as whenever I'm talking about return to sport with any students, I always go to, well, what's the consensus frameworks or consensus statements on that? And you know, many of you will be familiar with the consensus statement around returning to sport from injury by Claire Arden in 2016. But some of you may not have dug deep and actually found out that one of the key take-home messages in this best practice consensus statement is psychological factors should be taken into account during rehabilitation and at the time the athlete is making their transition back to sport, which includes transition back to training and back into competition. Okay, so if we're not, for example, looking after making decisions on psychological factors, we're not really mimicking what best practice tells us we should be doing. Okay, I really like the infographic on the left hand side of your screen there, because this is the process, guys, of how we may end up being able to be more psychologically informed in our practice. And the bit I really want you to take home from this is the bit that's at the top left of that infographic. Many of you that are working with teams will be familiar with the medical emergency action plan, our premeditated plan that we have in place in case an emergency happens on the pitch. Now, why I particularly like this suggests that as a group of practitioners, we should almost have our injury plan set up before injuries happen, so that rather than becoming reactive about injuries happening in our settings, we are proactive, that we can quality assure the injury journey of every athlete or every patient that we're going to see. So factors that might feed into this, almost this pre-injury plan to enhance the psychological factors are: everybody understands who the key stakeholders are, and all the key stakeholders know what their roles are, that actually they understand that they are all important to some degree at supporting injured athletes, that actually you know how the athlete's needs are going to be assessed. You know, for example, what sort of goals the athletes may need to be developed. What type of goals? Are they multifaceted? Are they just very simple return to sport goals? What's the process of monitoring that athlete? How regularly? What form is that going to take? And then how are you going to communicate amongst all of the stakeholders so that athlete gets really coherent and not fragmented advice? Because there's one thing that drives an athlete absolutely crazy when they're injured is conflicting advice, contrasting perspectives, which only adds to the fact of they don't know who to turn to for support, guidance, and enable them to self-manage that situation. But let's have a look then. Let's have a look at if we start adopting a situation where we look at, you know, psychological factors as well as physical and biological factors in equal measure. Well, what can we expect from that situation? What can we think about in terms of some of the outcomes there? Well, number one is research would have us believe that our athletes are going to be more psychologically ready. which means they're going to be reintegrated back into training, reintegrated back into sport, far more confident that they're going to perform well and remain injury-free. Well, that's really important. Again, research would suggest that taking that approach, we're going to end up athletes who are more physically and functionally ready in terms of a better gait, better landing mechanics, and remaining injury-free. And actually, research would also suggest that these athletes are going to be more biologically ready. If we think that psychological stress has a clinically relevant relationship with protein synthesis, tissue repair, tissue adaptation, with its impact on modulating corticosteroids, catecholamines, that sort of thing. So the picture's much brighter for these athletes, that when we're sending them back to training, when we're sending them back to sport, they're going to be more psychologically ready, more physically, functionally, and biologically ready if we acknowledge and we adapt our practice to accommodate psychological factors. So let's consider, I was lucky enough to present at the new camp on a project, and I listened to someone called Jack Hickey speak, and Jack Hickey and Ryan Timmins are the kind of the designers of the hamstring quadrant of doom. And I kind of took the idea and put it into a readiness quadrant of doom. So I just want to consider some scenarios here for us to do. So we've got two axes. Okay, we've got psychological readiness at the bottom and we've got physical readiness up the top. Okay, so let's consider this then. So number one is I've got an athlete who has got low psychological readiness and I've got an athlete who's got low physical readiness. Well, that athlete is going to return to sport potentially anxious that they're going to get re-injured, anxious about their performance, and not have the physical robustness to meet the physical demands of that sport. How is that going to end up? Not particularly great. Well, let's consider this then. Let's consider I end up with somebody who might be have low psychological readiness, but what they end up with is they are physically ready. So they've had the adequate amount of muscle strength, muscle power. They've done their sport-specific training. What can we expect of that? Well, again, the outcomes aren't going to be too good because they're still going to be returning to sport. Yes, physically okay, but again, they can be anxious about their performance, anxious of getting re-injured. Well, let's have a look if they're high in psychological readiness, but low in physical readiness. And again, these athletes, they may feel confident that they can go back to sport. They may feel confident that they're not going to get re-injured. But without the adequate physical capacity to meet the demands of their sport, it's not going to be a particularly good place for them. But the best spot, and you can probably follow this story all the way through, the best place to be, guys, is, well, how can we then make sure our athletes are high in psychological readiness and high in physical readiness? Because that's the place that I want. That's the sweet spot, the Goldilocks moment. That's what I would hope for all of my athletes when I make decisions or when I work with them through rehabilitation, through reconditioning, through return to participation, all the way through to them returning to their sport. So what can you do? What can I do to improve my practice? Because if psychological factors, in addition to physical and biological factors, are important, well, how can I reflect that in my practice? How can I start moving my practice forwards? So the first thing is recognize and monitor. Okay. Now, there's lots of really cool tools out there for us to start monitoring our injured athletes. Okay. And I've kind of put several there, and I've kind of put, it looks like, you know, a sea of acronyms here. So I've put the full names of the tools at the bottom. But we've got scales that measure psychological readiness, and we have scales that will measure other variables that might be associated with psychological readiness, such as anxiety, fear, kinesiophobia. So I just deal with these or talk through these individually. We've got the ACL Return to Sport After Injury Scale by Kate Webster. There's a short version of that, or a short form version. So the original version is 12 items. The short version is 6 items. Now, what's really cool about that, guys, is you can get a free app and get your athletes to download that free app, and then they can then fill in that questionnaire and then email that to you, so you can monitor them throughout their injury journey. Now, that is ACL specific. So there is a shoulder instability return to sport after injury scale. There's also an ankle ligament reconstruction return to sport after injury scale as well. Okay. What I would say is the ACL RSI is actually being used across multiple pathologies. So don't be overly concerned about the ACL-ness of it. It can still be used. There's the psychological readiness of injured athletes to return to sport scale. And then the one that I use in my practice is the injury psychological readiness to return to sport scale. It's probably the only scale that directly measures psychological readiness in the form of confidence. It's 6 items. It's really easy to use, and it just gives you some information. Okay. We've then got 2 others. We've got the Tampa scale of kinesiophobia, and we've got the re-injury anxiety inventory. Again, as a practitioner, I use the re-injury anxiety inventory. It's 28 items, but it's got 2 subscales about their re-injury anxiety during their rehabilitation and their re-injury anxiety about re-entering competition. So really, you can use those subscales or the total score to start evaluating the intensity of their re-injury anxiety. Now, a number of these have published thresholds that we're not quite sure the veracity of them, okay, in terms of being clinical thresholds. So, for example, the IPRRS states that you being 50 or greater, you are psychologically ready. The Tampa scale of kinesiophobia says if you score 37 or higher, you've got kinesiophobia. The veracity of some of these thresholds are questionable. Okay. What we need to do, and when we're not there yet with these tools in this sort of area, is have better instruments to measure what we want to measure. Okay. So for me as a practitioner, what would make better sense is, in the absence of truly fantastic tools out there, that maybe we look to triangulate from using a number of these tools so we can form more rounded and robust decisions around our athletes. But how do we then use them? So number one is, how can I be more psychologically informed? And, you know, I'm not a huge fan of the word psychologically informed, because I think all rehab should be psychologically informed. All your reconditioning should be psychologically informed. But this is how to be more psychologically informed. So what we'd want to do, guys, is we'd want to evaluate these psychological factors using the said tools and triangulate maybe from those. But don't forget, these are only tools. And really, we would want to combine our impressions with using our working knowledge of that athlete. And that's really important, because that's been gleaned from hundreds, thousands of hours of working with that athlete. You know, you share their journey, you know the good days, the bad days, the successes, the setbacks. And really, you develop that really important working knowledge. So our advice would always be, yes, use the scales, or what I've referred to as tools, but also use your working knowledge of that athlete. Now, what you would do is you would use these impressions to make more rounded clinical decisions. So you'll be sat there, hopefully with shared decision making, talking about the athlete's physical readiness in relation to, for example, limb symmetry around strength and power measurements. You'd be talking about their biological readiness, maybe in that kind of that crude and indirect marker of time. But then you'd also be making your decisions based on psychological readiness from the kind of the tools and your working knowledge. And it's really when we start considering all of those things, we make some really, truly great rounded clinical decisions, which hopefully lead to better outcomes for our athletes and our patients. And the last bit is we want to continue to monitor these in order to inform decisions throughout the rehabilitation and recovery journey. It's not a one-stop shop. Really, we want to continually monitor them. We want to continually meet. We're continually making clinical decisions. And we really want to use these tools and our working knowledge to inform the progression within that journey.
So one of the really important considerations here is that actually we are working with, as we've alluded to a few times, kind of complex 24/7 individuals, but the contact time that we have with them as injury practitioners is actually, it's really minimal. It's a drop in the ocean, really, by comparison. And I think then some of the challenges that we face there, particularly if we can all relate to that athlete who expects us to just make them better. And if we work then in such a way where we've got an overemphasis or almost a reliance at times on kind of passive treatments and those sorts of things, then we can start to think about whether, well, actually, are we missing a trick, and are we contributing to that scenario where athletes feel more dependent on us? And really, the questions that we need to start thinking about is, well, what are they doing for the rest of the day or the rest of the week to be able to facilitate their recovery from their injury? So we're going to talk very, very briefly now through some of the different ways that we can actually start to work with athletes around some of the different ways that we can deal with one of those key challenges that comes up around rehabilitation adherence. And yeah, this idea of just letting the athlete off the leash. So how can we work in such a way where the athlete feels more empowered? We can help to support the athlete's rehabilitation adherence and those sorts of things. Now, we've produced this nice little Venn diagram here, which are just a series of recommendations. So starting at the top, this idea of forming a really strong, collaborative, non-controlling relationship with your athlete. So having open conversations around kind of perceived barriers to adherence, working with our athletes to kind of co-create some of those different solutions that might then help to overcome some of those barriers is important. Having really clear, really honest, and really open and understandable information shared with our athletes, but rather than assuming that they understand all of that, just openly invite questions or any comments or queries around the different type of information that we've shared with them. So really give the athlete that platform to have an input, to ask questions, all those sorts of things. And if we then move around in terms of the educate aspects of it, well, educate the athlete about what, and we often have this idea of injury education is really important, but if we start to think about some of the things, well, actually, we can work with the athlete to educate them about their injury and the return to sport protocols and how we can start to work through those different aspects of it. And again, that's really important because building that knowledge around the injury, building that knowledge around how we can progress through the different the stage of rehabilitation, what the return to sport protocols and how we're going to get there will be, helps to develop that sense of control, excuse me, for the athlete. Helps to really increase the athlete's kind of sense of competence in their around their ability to progress through those different stages. It can be really helpful from lots of different perspectives. We've had a couple of questions that kind of came through around motivation and different ways that we might be able to help to inform our athletes, and actually involving the athlete about some of those decision-making processes and how they can start to what are the different milestones or the different stages or the different landmarks to be able to progress through becomes really important. So encourage your athletes to share their thoughts. Encourage your athletes to share their thoughts or share their opinions about the rehabilitation, about the activities and those sorts of things. make sure that you kind of giving the athlete the platform to start talking about some of the different elements that they're interested in. Help it if you're providing a real kind of clear rationale for the rehabilitation activities, acknowledging the patient's feelings, their perspectives, providing them with an opportunity and input into decision making. It's really then giving you as the sports therapist the opportunity to show that you've taken their thoughts on board. And there's some of the different ways that can really enhance or can contribute to enhancing their motivation towards the rehabilitation activities. One of the things that we know from kind of prospective correlational evidence, from randomized control trials, all those sorts of things, is that actually, multifaceted goal setting is a really important part of enhancing rehabilitation adherence. But yeah, the common things that you might think about in terms of goals related to particular sessions, goals related to particular stages of rehabilitation, progression through stages of return to sport, all those sorts of things are important, but actually more multifaceted goals that maybe include lifestyle, so goals relating to sleep or diet or maintaining interpersonal relationships, goals that might relate to technical or tactical aspects of the sport. Those sorts of things are also important in terms of enhancing those elements of rehabilitation adherence as well. So really working in such a way where the athlete's behavior will kind of correspond to some of the shared recommendations, and in essence, they're doing the things that they need to do to be able to progress through, but also the athlete then volitionally engaging in that rehabilitation, and they experience that sense of control and competence throughout the rehabilitation period, and certainly through that return to sport journey.
Now, I'm just aware of time, but here are some strategies that I use within my own practice, and I've tried to kind of highlight. I'm happy to speak over those during the questions, but like I say, I'm conscious of time. But a couple of really easy ones for me is providing injury homework, and at the end of every session, providing a plenary, which is, what have we learned about your ankle today? What have we learned about your shoulder today? And let that athlete relay back to you what have they learned from that session in terms of what they can do. Is a really important point, as if you try to educate them on that sort of journey.
In closing, then, so some of the key things to start considering around key takeaways from today. So you are, as sports therapists, a really important part in fostering an athlete's health throughout rehabilitation, throughout recovery. The way that you work with your athlete will influence the way that they respond to their injury. It may even influence the way that they respond to their injury, should they, touch wood they won't, but should they experience the same or similar type of injury again. So the way that you work is an important consideration in that. And psychological factors are important precursors, and in some ways can be predictive of rehabilitation outcomes. They can be predictive of return to sport outcomes, re-injury outcomes, and lots of different mechanisms behind that. Now, as Dale alluded to earlier on, one of the key messages or one of the key take-homes through here is that actually all of your work in some respects or another will be or should be psychologically informed. And part of the purpose of today is, well, how can we support you in making that more psychologically informed? As Dale alluded to, a lot of the evidence behind this is that sometimes core education doesn't necessarily prepare people fully for some of these challenges, and hopefully some of the different practice suggestions that have come through today have been helpful in that respect. And some of the key things that we can start looking at here is, well, actually, how can we screen? How can we use our evidence to inform what we're doing? How can we monitor our athletes? What are some of the different ways that we can look to provide that high quality social support that's really important? Who provides it? When? How? Why does that become important? And what we know is that actually, in terms of exposure to social support, it's a really important precursor to more successful rehabilitation outcomes for lots of different ways. Educating the athlete about themselves, about the injury, helping them to construct their understanding of how they can progress through the different stages of rehabilitation, so that they feel more empowered then as well to be able to have involvement and ownership around rehabilitation activities, decisions that are made, why they're made, and really having that active patient athlete involvement in setting shared goals that are agreed across the kind of support team with the athlete, or on that one-to-one relationship between therapist and athlete, but very much putting the patient or the athlete at the centre of that decision-making process around return to sport, and having them actively involved in all the process throughout.
Okay, sorry we've run over a little bit.
No, that's absolutely fine. Thank you both so much. That was really, really informative. And I just love the whole concept of us as sports therapists do have a role to play here, and we are the ones that, as you say, we see our players and athletes and clients through their injury journey. We are the go-to people, and we're the ones that are there all the time for them. So it just makes absolute sense, and I just question why not? Why would we not address it? Like, you know, it's so important. So I think you've really given us a fantastic overview there. I know it is very difficult to kind of talk about everything in that sort of time slot. I appreciate that. You could go on forever. But yes, really fantastic. So thank you very much. We do have some questions in the chat now, if you're okay. I will just pose these to you, and we'll see how many we can get through in the time remaining. So just bear with me. Let me just flick back through to some of the first ones. Okay. So we've had a question from Christian. In an ideal world, would you suggest educating athletes on the injury experience, positive and negative, prior to them becoming injured, and maybe as part of a pre-season briefing?
For me, I'm all in favour of taking a real proactive approach. So I, for one, educate my athletes on their return to play criteria before any injuries happen, and that's part of their kind of induction handbook. And part of that is to manage expectations. Probably the worst thing, you know, that can happen is if an athlete's injured, they don't have the tools to be able to fix themselves. Suddenly layering on, and these are the hurdles you're going to have to go over to return back to the sport that you love and that you want to. I just think that's to help them manage that expectation, putting it pre-injury and almost going forearmed and a proactive approach around injury is really important. And the same around, for example, returning to sport from musculoskeletal injury, well, the same goes for returning to sport from concussion, for example. You know, and many of the people in the audience here might know that's a really tricky thing to manage. You know, you're out for a long period of time. If we take the 14 days plus that 6 stage or even longer return back to sport. And it just helps manage expectations. It helps manage expectations of coaches. It helps manage expectations of the patient and the athlete. So as much as you can do pre-injury, the better.
Absolutely. Adam, any thoughts?
Yeah, I think it's a great question, Christy, and thanks. And I think one of the important parts to remember here always is that injury, obviously by nature, is an individual experience, and you know some of the things that we've done in the past, as Dale's alluded to, has been, you know, do various aspects of different types of workshops around particularly around kind of young athlete education, some of the challenges that they might face as well in their career transitions, and doing that from a way of helping them to navigate some of those different career transitions. And you know, those workshops have been everything around kind of dual career challenges and those sorts of things, but actually one of those you know does have a focus on injury and, you know, navigating injury experiences, and some of the ways of being able to not only manage your own injury experience, but the important role that, you know, that in this context that teammates have as well in supporting their peers through the injury experience, and being, you know, as really valuable social support providers as well. So haven't necessarily done it as part of a pre-season briefing personally, to answer the question directly, Christian, but the principle of it in terms of athlete education and doing different types of workshops around it being part of more general career transition type challenges, yes, certainly, and they've been quite well received. But the overarching consideration there is that, like I say, that injury is an individual experience. Each athlete will go through different things in different ways at different stages, and just making that a real clear part of that education as well.
Yeah, absolutely. And as you said, Dale, as well, it's very similar to how you educate your players about their MSK injury. You know, it forms a really important part of the whole process. So again, I just think, yeah, tying it all in, absolutely agree. So we've got a good question here about what methods have you used to openly begin discussions around possible psychological factors that athletes might be experiencing? And could this be difficult for them to openly admit to?
So, I mean, there's three things from my point of view, and Adam will jump on board with some of these, I think. So for me, the pre-injury relationship you have with players is vital. That you're just not somebody who is viewed as the clinic merchant who you only see around, or they're only bothered with you if you are injured. That actually you're out on the pitch, you're saying hello to them, you're meeting, greeting, having lunch, developing a pre-injury relationship, so that when they are injured, really that developing that relationship into being collaborative, open, honest, transparent is already there. So that's more footwork that you can do before you're injured. I think allowing time to listen and allowing the person time to talk is really, really important. And I think in the back of your mind, you know, and it came out of a review that I did, which of some papers, which found you've also got in the back of your mind that often athletes will guard how they're feeling. So you've almost got to create a safe environment to recognize that it's okay for them to talk about, you know, their fears, their apprehensions, their concerns about progressing, and that it's okay if they have concerns. You know what, in my return criteria, progression criteria, being psychologically okay to progress from very much clinical work to more kind of gym-based work to then progressing onto the pitch. They've got to be psychologically okay to allow you on that journey with them, really.
Yeah, and I think just to echo that first point, I think, you know, working from more of the psych side of things alongside Dale for I don't know, more years than I care to remember now, mate. That perspective of being there, being visible, being present, and being almost in air quotes just, you know, a normal staff member becomes so important around being able to have those conversations. And again, when, you know, I think it's a fantastic question, and thanks for posing it. You know, if the way that you work as a multidisciplinary team is that you have your sports therapist and you have your psych practitioners and your other people that are involved, then, you know, we've got strength and conditioning coaches mentioned a little bit later on in another question. If the relationship there is that they're brought in to fix the broken athlete, then you're on a hiding to nothing to start with, really, in terms of how you can maximize the benefits of that. And, you know, I will often attribute as much of the importance of the work that we do is based on being there, being present, being able to, you know, just go up to athletes that we're working with, say hello, talk to them about the day, just have a general conversation and those sorts of things. And that just becomes, it's relationship formation. But actually, if we look at a lot of the evidence behind some of these, what we call more common factors, things like, you know, shared goal commitment, a working reliance, a strong therapeutic relationship, those sorts of things, which are they're not psych interventions or anything like that. It's common factors of relationships with people. They're just as important in terms of some of the outcomes of some of the work that we might do, as whichever type of treatment it is that we use as well. So, to echo some of those points, yeah, the groundwork into developing some of those. In terms of more directly around beginning the discussion, yeah, and, you know, kind of some of those honest, open questions that you can ask once you're at that point. How are things going? How the important question is always, how are you, rather than how's the injury? Because we always need to keep in mind that there's a person that's attached to that injured tendon or that injured ligament or that whatever. You know, so asking a person how they are puts the emphasis and the importance on them as an individual, as opposed to putting the emphasis on the injury. And the framing of that question becomes important, because you're encouraging them to talk about something different rather than just the injury. So just though, I guess two or three different suggestions there for you, and that hopefully will be helpful.
And it's really tricky, isn't it? For people that work within clubs, having a good pre-injury relationship is probably easier than people that are working in clinical settings, where, you know, they're seeing people that might walk in cold, and, you know, and that relationship will take time to build. And I think it's okay for, and to be quite vulnerable and say, you know, our first few sessions is about us working together and learning how to work together collaboratively, because nobody kind of flicks a switch like that to say, do you know what, we'll have an effective working therapeutic alliance or therapeutic relationship. It does take time and trust on both sides. And, you know, they're probably your first and your second appointment's greatest aims, really, to start building that therapeutic relationship.
Yeah, absolutely. I mean, I'm just going to kind of throw in another question to add to that now. So thinking about that, is there anything you would do differently when you're actually working with under 18s? I mean, I know, Dale, you work in youth sport as well, but do you adapt your approach to that, do you think?
Yeah, 100%. So I've got parents there for one. And so one challenge for me is I've got to make players who may be 8 years old all the way to 16-year-old, and parents know exactly what the issue might be, what it also might be, what their journey is ahead, what the conditions are them to progress within that. So I spend lots and lots of time educating. So I use the injury homeworks. I use the session plenaries. I give athletes questions to take with them from appointment to appointment, because, you know, you'll be the same as me, Hayley, where we ask people, you know, do you understand? Have you got any questions? And you know, maybe everyone in the audience will go, oh, actually, I've had that experience. And you know what? Nobody's ever asked any questions. And it's because I'm sure that these athletes, and particularly young athletes, don't know what questions to ask. What should they know the answer to? So I've got a little sheet I create with questions that they can take with them. So of questions they should know the answer to if they go, for example, to the hospital, or they go to their GP, or they maybe see another private therapist. Things that they should know to educate them about that, because part of me isn't about dealing with that particular person and that injury. It's almost trying to safeguard that if it happens again, they might have enough tools to be able to fix themselves, or certainly that self-awareness to know what's going on and why.
Yeah, and I think it's nice for me, actually, because I can see that we've got quite a few of our level 6 students on the call here, and some of them will be able to relate to, you know, some of the things that we actually talk about in classes are, okay, how do you explain this to an 8-year-old? How do you explain this to a 10-year-old? More importantly, how do you get an 8-year-old, a 10-year-old, or a 14-year-old to explain it to you? And there's lots of different things that we need to take into account there as well. Not only just things like the degree to which they'll be able to understand what you're saying. It's as people are going through those different life stages as well. You know, we know that as people start to go through, go through teenage years, there is an increased need for autonomy. There will be an increased emphasis on kind of social relationships. There'll be an increased emphasis on the types of relationships that they might have with people that they perceive to be in positions of authority, and how that might lead to more kind of socially desirable answers or those sorts of things. And again, we've got an important role to play in altering some of those perceptions and helping people to understand the importance of, we always use the words of openness, honesty and transparency within those, but also let's not lose sight of the fact that we've got some really valuable stakeholders there, developing really strong relationships with parents as well, so that we can have those conversations. Naturally, you know, there's certain limits and different things we need to take and consider. We've got another question later on around coaches and managers. Again, really valuable stakeholders if we can develop that working relationship in the right way. So yeah, I guess just a couple of extra additional considerations in there, just around, rather than necessarily the what we do, maybe more a little bit about how the people that we're working with might need us to do the what.
Yeah, absolutely. We have had quite a lot of questions, so I am going to have to just pick another, maybe one or two, before we close for the evening. But I thought a really good one that came through, I'm just trying to find it now, bear with me a second, was about kind of approaches you might take if your athletes have kind of developed very limiting beliefs. So like maybe they're a bit more, they're convinced of that a certain way, or you know, a certain belief that doing certain activity is going to cause them more pain. How do you kind of, how would you deal with that kind of thing? So you've worked with them, but you've come to the conclusion that they've developed these sort of beliefs about a certain situation. How would you go around that?
Do you want me to take that one to start off with, mate?
Yeah, you go for it.
Yeah, so I guess the first instance would be being a little bit reflective in the first instance, to allow yourself to understand why you've drawn that conclusion. And as in, you as a therapist, what is it that you've seen? What is it that you've experienced? What is it that the athlete or the patient has said or done that is different to normal, that's kind of got them to that point? Then, and again, it's one of those situations where, as with everything in here, it'd be very much individual specific in terms of how you're working, but some general suggestions would then be around, well, okay, going back to some of those education suggestions, okay, why are they thinking that? What is it that's got them to that point? What are the sources of information that they've used? Because you know, it won't necessarily just be what they're feeling within their body. We know that, you know, at times Dr. Google's the worst doctor in the world when it comes to symptoms and ailments, those sorts of things. Then working from the perspective of, again, rather than just telling people information and giving people answers, using questions in the right way that will help people to construct, using, I guess, more kind of guided questions that will help people to then construct what is possibly a more facilitative level of understanding that might encourage them. Now, in terms of some of the fear avoidance parts of it, some of the fear of movement parts of it, and those sorts of things, helping people to be gradually exposed to the things that they're scared of in such a way that works for them on an individual level is something that we've used with a number of athletes at different ages and in different sports. But again, getting them as part of that process to really kind of consciously think about consciously thinking about their achievements in that perspective and how it is that they're developing and the ways in which they're developing to be able to keep moving forward. So again, it would be very much, Alana, a fantastic question again, and thank you for it. And it's one of those where they will always strip it back, so it'll be working with individuals on individual cases. But again, some suggestions there from practice of how we've managed that type of situation in the past. And Dale will share a few more of those from different types of populations as well.
I mean, with chronic pain, where we see a lot of these fear avoidant behaviours and these misinterpretation of what is painful versus what shouldn't be painful, it's quite good to educate them using the car alarm kind of analogy, which is, do you know what? You've got the car alarm, which is the pain signal, but sometimes it just goes off, even though your cars are not actually getting broken into or damaged. So maybe trying to explain to them why they're feeling that way, using a lovely analogy. But I also find it's quite liberating telling athletes that it doesn't have to be pain-free. I think lots of athletes think that every exercise they do has to be 0 out of 10 on the pain scale. And if we keep telling them that, I think that perpetuates their avoidant behaviours. If we say, actually, we're going to work to maybe a pain threshold where small amounts of discomfort is tolerable, suddenly that switches their mindset to going, oh, actually, it does feel a little bit uncomfortable, but I can still exercise, I can still move, I can still do that mode or that intensity or that duration of the exercise. So actually not putting the shackles on them in terms of everything needs to be pain-free and saying, a bit of discomfort is absolutely okay. Obviously, it's within a threshold. Anything above that threshold is going to be pain and we need to reevaluate what we do. But if it's below there, then really we can start dripping in movements, exercises that hopefully when they see they can do that, and we switch that attitude, I can do that without this feared response, that it offsets some of that a bit.
Yeah, so it's kind of getting them to see the positives of what they're doing rather than focusing on maybe perhaps the pain or whatever they're avoiding rather. Yeah, great. No, it's a great question. Thank you. I think that's something that we can all sort of relate to. It's something that we see quite a lot as therapists. So I think we will just end on one more question because I thought it was a very good one about how you manage career-ending injuries from a psychological perspective. Because I mean, I think a lot of us have probably been there with our injured athletes at that point, and there are obviously a lot of emotions floating around there. So what would you do to kind of work with that? How would you help them? How would you help them through?
Well, ultimately, I think that decision has to be theirs. They have to come to that decision themselves. I think if that's a decision that's enforced on them, I think that is a dangerous road ahead for that particular athlete. And that really the decision needs to be shared and have different stakeholders going into that. So that would be my advice in terms of career ending, that, you know, ultimately you may think that's the best decision, but they've come to that decision, and really you've explored alternatives, that you've kind of explored the pros and cons of continuing versus ceasing that. Is there any sort of transferable skills they've got to other sports, as opposed to it's all been feast and now it's famine, I can't take part in anything? Because we know, again, if that is inactivity, then they've got other health issues that are lined up. Adam, from a psychologist's point of view, what do you think?
I mean, it's one of those situations again where actually it's saying the best is the wrong way there. One of the ways that people commonly prepare athletes for the end of their career is to start preparing for it whilst athletes are still in their career. Lots of different ways around what other activities or opportunities are going on outside of sport. It's lots of certainly high level athletes have different types of business investments and those sorts of things going on. Working in such a way where we can emphasize different elements of physical activity, and how we can help people to become or to maintain their levels of physical activity post injury, so that people are still experiencing just that sense of movement in whichever way it happens. Because obviously when it comes to certain aspects of career-ending injuries, the way those movements occur might need to be adapted. In terms of, I guess, assuming that when somebody's career ends because of an injury is purely negative all the time is also at times can be too simplistic. If an athlete's been injured on a number of occasions, or they've had a recurrent injury, and because of that they've made a decision to retire, actually at times it can be a little bit of a relief that they've made that decision, and for them that's the end being in sight. Now, some of the major challenges, I guess, that can come when it comes to career-ending injury particularly, and by career-ending injury, we mean an injury that has enforced retirement rather than an athlete choosing to retire even if the injury doesn't necessitate it. Certainly, elements of that real sudden loss of athletic identity can be really important and can be really profound, and is strongly associated with elevated levels of depression and those sorts of things. So certainly something to consider. So making sure that you've got those important referral networks in place is a real key consideration for you. But also, again, depending on the level that you're working at, there's all sorts of other things that athletes can face as a result of those career-ending injuries. So athletes that are constantly that are constantly seeking that next high or that next challenge or that rush, that excitement of the danger element of it. So it's not uncommon that athletes in those instances might start looking at gambling and those sorts of things, and whether or not there's a support needs in there. Now, that for you as sports therapist, that's not necessarily your role, but you being able to refer your athletes to the right people centrally is your role in that respect. So again, probably just giving you loads of different kind of suggestions, loads of different considerations there, that it's such a broad area to consider. But certainly the key things are that the more within an athlete's career you can help to prepare them for the end of their career, then evidence suggests that the better that transition will be. In terms of if it's a very sudden end, then yeah, there is an increased likelihood, like I say, of a lot of the, different kind of mental health concerns. There's certainly issues around that loss of athletic identity, that loss of sense of self, and those sorts of things that can become really important. And again, certainly from somebody looking at it from a sports science perspective, for the kind of a more psychology background, from more of a psychology background, even in certain circumstances, I'd be looking at it and thinking, right, well, who might I need to refer people onto for a different type of psych support if required?
Yeah, thank you. Thank you both so much. That was honestly so thought-provoking, and I'm sure many of us and the audience today will agree that we've actually had quite a lot to take away from that. So thank you. Just a quick message from me and from the comms group. I just wanted to say a huge thank you to Professor Graham Smith for everything he has done over the years, and to get us to where we are now. It is so sincerely appreciated. I can't even express it enough. But I just wanted to say, from my perspective and on behalf of the comms group, and I'm sure many other members, thank you so much, and we really wish you well in your new role as president of the society. So thank you. And on that note, I'm going to close for the evening. So thank you everybody for joining us. We have really appreciated your input. And again, thank you massively to both of you, Dale and Adam. And I'm sure we'll all be in touch again soon. All right. Thank you, everybody. Have a good evening. Bye-bye.
Thanks, everybody.